So I'm going to be comparing occupational therapy to physical therapy. They're both types of rehabilitative care, and they both follow similar steps in assessing, treating, diagnosing, evaluating, and educating clients. But another way to look at it is that occupational therapists are more focused on enhancing the individual's function, and physical therapy is more about enhancing the individual's movement. So, like I said before, physical therapists are focused more on improving the patient's ability to move their body, and they are sort of more, or what I consider, movement experts. They are prescribing exercises that focus on restoring the patient's ability to move one specific area, say like the shoulder or the hip or something like that. And they're more focused on that range of motion, that stability, mobility, and reducing that area's pain. And they're more focused on the gross motor skills rather than the fine motor skills like occupational therapists are working with. And another way I differentiate the two is that physical therapists are less focused on the why. They're more focused on, like I said before, that one specific problem at hand. But occupational therapists, on the other hand, they're more focused on improving the patient's ability to perform activities of daily living, they're modifying and changing activities and movements so that the individuals can remain independent. They could either modify the activity itself, their environment, or just the skill, just so the person can, still remain or feel that sense of purpose. Some activities that they help with are being able to hold a toothbrush so you can brush your teeth, being able to hold a knife and fork so that you can cut your food, and the movements of being able to get dressed. Those are just a few examples. But occupational therapists, they are also incorporating parts of cognitive disabilities. They work with emotions and behaviors and a lot of mental health aspects, as well as the whole person, rather than physical therapy just focusing on, like I said, the issue at hand. And that's the crucial part of why the physical therapist wanted to make the switch, is because occupational therapy are more about helping that person feel a sense of purpose. They're treating the whole person and looking at the bigger picture rather than just the issue at hand. And that is what they really, the physical therapist actually took hold of that fact and really enjoyed that part of occupational therapy.